Hi, my name is Suzanne Gregory, and I'm here to talk with you about my long-term care interview that had to do with enhanced community care management, which I will refer to as ECCM from here on out. ECCM is a type of community-based care. There's several types of community-based care that's developed over time in response to differing care needs, including home health care, hospice care, and adult day care. Now, ECCM is a unique community-based care that seeks to support the needs of its customers in the care setting of their choosing while improving their quality of life. Through care coordination, ECCM can help ensure that patients are able to express their care wishes and connect with needed resources that can result in improved clinical outcomes. I did have the opportunity to interview Krista Thuran, Director of Clinical Programs for ECCM, to learn more about the innovative program and the customers that they serve. Krista did share her background as an advanced practice provider. She has a lot of experience prior to coming to ECCM with an accountable care organization and various clinically integrated networks, even including emergency and trauma services. And while she does like trauma services, she really found herself drawn towards the elderly population because she had an ability to get to know the person and their family and really enjoyed working with creative solutions to keep them in their homes and out of the hospital. Krista got to know ECCM and their goals while she was working with an ACO, and because she held common shared interests, decided to apply to work at ECCM once a position opened up. She really admires the chance to live their philosophy and really work on person-centered care plans rather than provider-centered care plans. She feels that through ECCM, they act as advocates for patients in whatever place they consider to be their home. It can mean caring for someone while they're in their home, but it also could mean caring for them while they're in an assisted living facility or personal care home, because someone can be open with ECCM in those settings. The population that ECCM serves, they are usually someone with an advanced illness, or they have some degree of frailty. They may have multiple medical conditions and social determinants of health insecurities, meaning they have various financial needs. This population will be geographically located in the states of Pennsylvania or Delaware, and they have to be covered by one of Highmark health insurance plans that has ECCM as a benefit, and that includes their Medicare Advantage plans, their Medicaid plans, their ACA plans, and then their Healthy Way insurance plans. People are provided with in-person, telephonic, and virtual support services, and those services have helped ECCM to serve over 13,500 patients since the program began in 2016. Since this is a benefit of a specific insurance plan, there's no bill to patients and the services themselves are not billable. Krista described the services of ECCM, and it's really clear in hearing about them that they are neither hospice nor home health care. Instead, the services fall somewhere sort of in between. Like both a hospice model and a home health care model, ECCM does have a multidisciplinary team that includes advanced practice providers, doctors, nurses, social workers, and care coordinators. Although there are similarities, there's key differences between ECCM and hospice or home health care. You can see here in the supportive care continuum that ECCM can start early in the course of disease and may ramp up support throughout illness all the way up till hospice care. Hospice care, which is used to provide comfort towards the end of life, is really for when someone has decided to stop curative treatment. Patients who are not yet ready to stop curative treatment are not yet eligible for hospice care. ECCM services also can work to provide comfort and support to patients, but they can start while someone is still under treatment for active disease. So they can be in place before someone qualifies for or is ready for hospice care. Krista, in talking with her about ECCM, one of the things that they do very well is to have and document goals of care conversations with patients and their families. Now, those conversations can be an important first step in a patient considering hospice care for some time later, but that's not really the point of the conversation. It really is to establish the person's care goals and make them known to providers, because they want to make sure that the care that's provided to patients is concordant with a person's wishes. Now, Pratt called out the philosophy of home health care as taking health services to the consumer rather than requiring the consumer to go where the services are delivered. ECCM is similar to home care in that fashion. They provide services in the home. Patients can have visits from nurses, advanced practice providers, or social workers. And ECCM also offers telephonic and virtual visits. Unlike most home healthcare agencies, ECCM does not require people to be homebound to qualify for services. Now, the services that they do offer differ somewhat. While home care can offer skilled nursing care to infuse IV medications, change dressings, physical therapy, various therapies, and non-skilled care from aides, ECCM does not replace any of those care types. Although patients under the care of ECCM may be seen by a physician or advanced practice provider under ECCM if they need treatments for symptoms that are uncontrolled. So the services that ECCM provide are more geared toward advocacy and care coordination to improve the quality of someone's life, relieving the stress of coping with illness. A patient can be active with home health care and ECCM at the same time. Dr. Rachel Ombres, an ECCM palliative care physician, shared the success of the ECCM program in a 2023 interview and discussed achieving a 70% reduction in hospital admits per 1,000 and readmissions per 1,000 for members enrolled in ECCM. The program also talks about a Net Promoter Score, which is an indication of patient satisfaction, of 73, which is far beyond the usual benchmark scores in healthcare of around 38. ECCM also has impacted unnecessary emergency room visits by providing their patients with a way to talk to their provider virtually to manage uncontrolled symptoms of a chronic illness. Krista did share some challenges with me of this new innovative model, and one of the biggest challenges that she talked about is conflict over who is steering patient care when there's multiple providers, multiple hands in the pot, figuring out who is steering that care, who is calling the shots, and how the different providers can closely coordinate. She also talked about how those goals of care wishes that are so very important to their population, once they're established, they can kind of get lost when there's multiple level of care transitions. So if, for instance, they see one of their patients gets admitted to the hospital, the ECCM care coordinator might be able to see in the electronic health record that they're receiving care that's inconsistent with wishes that have previously been expressed in legal documents. So when this happens, ECCM collaborates with providers and the family to really sort of address any discrepancies that there may be. Another big challenge that ECCM has is when patients who are referred for services that they don't qualify for them, like either they may not live in the area or they may not have the specific health plan that offers this program. And that's not unlike hospice and home healthcare services. They also may be referred patients who don't qualify for their services either. Now, home healthcare agencies may be able to provide services under a self-pay arrangement in those cases. Unfortunately, ECCM is not able to make those types of arrangements because they're not able to bill for their services. Also, ECCM is not accredited or doesn't have a state licensure as a provider organization. Instead, all of the healthcare professionals within ECCM, they're individually required to carry a state licensure. And this factors into why there are some geographic limitations restricting where ECCM can provide care. ECCM doesn't financially compete with other members of the patient's care team since they don't bill for services. So this means that someone can live in a nursing home and still receive care coordination from ECCM as long as they're in the geographic area and they have the right health plan that has this ECCM benefit. Probably a huge challenge as well is when either the provider or the patient doesn't see the value of palliative services, which is like kind of a keystone of the ECCM model. ECCM's vision, according to Clements, is to be the premier high-risk population management and community-based palliative care solution. So ECCM sees getting provider buy-in to be an important first step to help patients see the value as well. Krista talked about, sometimes there's some resistance to the next level of care, and talked about her team, they can kind of see the train wreck coming. They can see that downward spiral. So to help a family sort of express their actual goals, the team is specially trained in motivational interviewing and Vital Talk, which is evidence-based training that teaches healthcare providers how to help elicit those end-of-life wishes that patients have. So Krista said, really when the word hospice is something that makes people uneasy, they don't say it. Instead, they just ask someone, hey, tell me what you want. Tell me what your goal is. And many times, patients describe all of the things that are included in hospice without even knowing it. In conclusion, despite ECCM's differences from both hospice and home health care, the ECCM care model does provide a form of community-based long-term care to a high-risk vulnerable population. Offering ongoing care coordination, ECCM is helping to bridge the gaps that exist between different types of community-based care. This program may also help patients and their families to learn about other long-term care that they can benefit from, like hospice. These supports have proven effective at helping their population to maintain the quality of life in the setting that they call home, with fewer admissions and readmissions. Thank you.